The patient can, and often does, within a period of hours, develop a level of self-understanding and self-acceptance which may surpass that of an average person. This is a statement from A Handbook for the Therapeutic Use of LSD-25, a study published in 1959. That was 57 years ago, before LSD, or lysergic acid diethylamide, was legalized virtually globally in the 60s. This study was considered a landmark for the use of LSD in a psychiatric setting, and the response from patients was overwhelmingly positive. Not only did many have catharsis, but a statistically significant portion of people treated claimed that the symptoms of their mental illnesses lessened significantly. Unfortunately, a combination of its criminalization and misconceptions surrounding it limit the potential regulation and use in psychiatric medicine. LSD, when dosed properly, and when one has the proper mindset and physical setting, essentially strips down many cognitive barriers, allowing your brain to connect information in ways that it didn't before, or achieve a level of catharsis. This isn't about seeing walls move or being amused by hallucinations. As already demonstrated in the past, LSD can be a powerful tool for enhancing talk therapy. A little background on LSD. It was first synthesized accidentally by a Swiss chemist by the name of Albert Hofmann. Hofmann worked at a pharmaceutical company and was attempting to create a respiratory and circulatory stimulant from lysergic acid and diethylamide compounds. Hofmann accidentally ingested a small portion and underwent the world's first ever acid trip. From then on, he continued experimenting with it and focusing on the use in psychoanalysis. The Handbook for the Therapeutic of LSD-25 is only one of a handful of studies on LSD as a psychiatric medicine, and up until 2014, research had all but stopped. One of the more recent studies done regarding the use of LSD in psychotherapy was a study done by Dr. Peter Gasser, focusing on alleviating the mental stress caused by terminal illnesses. Dr. Gasser is currently the only individual who has been cleared for experimental use of LSD in treating patients, and is considered to be continuing where Hofmann left off in his research, cut short, of course, by the illegalization of LSD. Now, while I am a proponent of using LSD in a psychiatric setting, I'm not recommending that we go ahead and fully legalize it right away. But condemning a substance with potential health benefits summarily without research is both unethical and irresponsible, as politics takes center stage over human health. LSD has a colorful history and complicated effects that are far beyond the scope of casual conversation. However, it is worth noting that there was already success in clinical trials when it was used in psychiatric settings, both in 1959 and 2014. So before chalking it up to a crazy idea or just a means of legalizing a drug, take a moment to skim through any of these studies done pre-criminalization, because in a few short years, LSD just might be the next big thing in psychology.